Okay, so if you're getting radiation therapy to your chest, you might be hearing about a side effect called esophagitis. And look, the good news is while it's common, it's also temporary, and most importantly, it's manageable. So let's dive into this so you can feel totally prepared and in control. Here's what we're going to cover. First, we'll break down what esophagitis actually is and what you can expect. Then, we'll get into your personal toolkit for managing it, everything from food and daily habits to medicines. And finally, we'll talk about how your care team has your back. And, this is a big one, when you need to pick up the phone and call them.
All right, let's jump right in. First up, what exactly are we talking about here? Understanding the what and the why is always the best place to start.
To put it simply, esophagitis is just irritation, an inflammation of your esophagus. That's your food pipe, the tube that carries everything from your mouth down to your stomach. As the radiation does its job on the tumor, it can't help but pass through that area, and that can temporarily upset the sensitive lining. Now, you're probably going to hear the word heartburn thrown around, so it's really important to know the difference. Think of it like this. Heartburn is the symptom, that burning feeling you get when stomach acid comes back up. But esophagitis is the condition itself, the actual inflammation of the tissue that the radiation causes. And that inflammation can make the heartburn and any pain with swallowing feel a whole lot worse. So, what might you actually feel? Well, that classic burning in the chest is a common one, or maybe some pain when you swallow. Some people even say it feels like food is kind of getting stuck on the way down. You might also notice a sore throat, maybe a little cough when you swallow, or just find you don't have much of an appetite. The key thing here is, the second you start noticing any of this, give your care team a heads up. Early is always better. Okay, that brings us to the timeline. This is where we answer those really big questions, right? Like, when is this going to start? And maybe more importantly, how long is this going to last? For most people, the journey looks a lot like this. The first week or two of treatment, you probably won't feel much of anything. It's usually around weeks 2 to 4, and sometimes a bit beyond, that symptoms might start to show up and build. But, and this is the most important part, after your treatment is done, things get better. They steadily improve, usually over the next 1 to 4 weeks. Now, it's super rare, but a narrowing can happen way down the line. But that's treatable too. For almost everyone, this is a short-term thing. So now that you know what to expect, let's talk about what you can do. This section is all about your proactive toolkit, and we're starting with the things you have control over every single day, your food and your habits. The goal here is pretty simple. Make food your friend. We're talking soft, moist stuff. Things like oatmeal, yogurt, and smoothies are fantastic. And here's a pro tip. You can make almost any food easier to handle just by adding some sauce, gravy, or broth to soften it up. And hey, if solid food just isn't working for you, nutritional shakes are an absolutely great way to make sure you're getting the fuel you need. And just like some foods can soothe, others can, well, poke the bear. So it's a good idea to take a temporary break from anything that can irritate that sensitive tissue. That means spicy foods and acidic things like tomatoes or oranges. And you'll probably want to steer clear of anything super hot or super dry and scratchy, like crackers or toast. That could make swallowing uncomfortable. It's not just about what you eat. It's also about how you eat and rest. And these 3 habits, they can be a total game changer. First, after you eat, let gravity do some work for you. Stay sitting or standing up for at least a half hour. Second, try to wrap up your eating for the day a couple of hours before you hit the hay. And third, using a wedge pillow to prop up the head of your bed can make a world of difference for nighttime reflux. Oh, and one more proactive tip for you. Your team might give you some simple, gentle swallowing exercises to do. These are just designed to keep the muscles in your throat strong and flexible, which is great for helping prevent any issues down the road. All right, let's move on to the second part of your toolkit, the medications that are available to give you some real relief when you need it. Okay, this chart is actually pretty cool because it shows how there are different tools for different jobs. You've got your antacids for quick on-the-spot relief. Then you have things like H2 blockers and the even stronger PPIs, which actually tell your stomach to produce less acid in the first place. And check out these last 2. They're pretty clever. Alginates literally create a physical raft that floats on top of your stomach contents to block reflux. And sucralfate works by forming a protective coating over the irritated spots. Your team will figure out which one is right for you. Okay, listen up, because this is probably the single most important thing in this entire section. Your care team needs to know everything you take. Not just prescriptions, we're talking over-the-counter stuff, vitamins, herbal supplements, all of it.
This is absolutely critical for your safety so they can make sure nothing interacts in a bad way.
All right, moving on, and this is so important to remember. Managing these side effects, it's a team sport. I promise you, you are not alone in this.
Your care team is working for you, both behind the scenes and right there with you. It starts way back in the planning stage, where they work really hard to limit how much radiation your esophagus gets. Then they'll check in with you every week to see how you're feeling and make adjustments. They can hook you up with a dietitian or a swallow therapist if that's what you need. And in those really rare cases where eating becomes just too difficult, a temporary feeding tube can make sure your body gets the nutrition it needs to stay strong and heal.
And that brings us to our last section, and it's your safety net. This is all about knowing when a symptom isn't just a nuisance, but a reason to pick up the phone right away.
Please take a good look at this list. If you experience any of these things, this is not a wait-and-see situation. Call your team immediately. If you get to a point where you can't even swallow liquids, if you feel dizzy or notice other signs of dehydration, or if you have any new chest pain, call. A fever that comes with painful swallowing, vomiting blood, or sudden choking, those are all signals to call right away.
Look, it all comes down to this. Your team is there for you. They want you to call. They expect you to call. So the single biggest takeaway from everything we've just talked about is as simple as it gets. If you are ever in doubt about something you're feeling, just make the call.